Good afternoon and welcome to the Senate Committee on Health and Human Services for the 83rd Legislative Session. Madam Secretary, please proceed to call the roll.
Senator Lang? Here. Senator Stone? Here. Senator Taylor? Present. Senator Titus? Here. Chair Doniate.
And I'm here. All members are present. Thank you so much. Good afternoon, everyone, and thank you for attending today's meeting. Today we have two bill hearings. We have Assembly Bill 19, which revises provisions relating to the statewide substance use response working group, and Assembly Bill 60, which revises provisions relating to certain behavioral health services. I'm going to take those bills in that order. We're going to do AB 19 first with our Attorney General, and then we'll do AB 60. For those who would like to participate in today's meeting, if you wish to testify, you can go ahead and sign in at the table by the door and provide a business card to the committee secretary. If you do not wish to testify, you may still want to sign in so that there's a record of who is interested in a particular bill in the event the committee may need to contact you. When testifying, please go ahead and turn the microphones on to speak and off to listen. And we have listeners and viewers in Las Vegas and online as we are recording this meeting. And last but not least, we ask for the public comments be kept to 2 minutes so that everyone interested in speaking can be accommodated. And lastly, we ask for folks to please turn off their electronic devices. We will go ahead and begin today's meeting with AB 19, and so I'll go ahead and open the bill hearing and invite our presenters to begin. And welcome AG Ford.
Good afternoon, Chair Donate and members of the Senate Health and Human Services Committee. My name is Aaron Ford, and I am your Attorney General. Delighted to be here to present Assembly Bill 19 for your consideration. My colleague, Dr. Terry Kearns, is my office's opioid coordinator. She is present in Las Vegas to assist me with the presentation. Also in the room with me are two of my colleagues, my Chief of Staff, Teresa Benitez Thompson, seated behind me, and my colleague, Mike Morton, who also works on my legislative agenda. The Statewide Substance Use Response Working Group, or the SURGE, as it is called, was created by this legislature in 2021. SURGE is responsible for recommending ways to create, maintain, expand, or improve programs aimed at addressing substance misuse in Nevada. Additionally, the group advises the state on the allocation of state and local funds to support these efforts. Through a diverse membership, SURGE produces an annual report with recommendations on the allocation of these funds, as well as policy and legislative recommendations. NRS 458.460 details the 18 members of the SURGE who represent government entities that oversee the provision of human services, treatment providers, law enforcement, advocates for those who have suffered with substance use disorders and their family members, as well as harm reductionists and prevention professionals, hospitals, and school representatives, as well as Nevada legislators. Through the course of the SURGE meetings in 2024, members of both the Nevada District Attorneys Association and Nevada's Department of Indigent Defense Services requested the SURGE consider adding a member from their respective groups to the SURGE committee. Additionally, the SURGE members identified other groups whose work is affected by substance use disorder and should be represented in the working group, such as emergency response professionals, the Division of Child and Family Services, and the public at large. The SURGE membership voted on and approved moving forward with this proposed legislation to increase the representation on the SURGE committee because the members felt that these important voices could be impactful by adding these additional member representatives. You will see in Section 1 the addition of the various individuals whom I just described. Additionally, we accepted 2 amendments from the Assembly hearing that will also be discussed. Chair Donate, with your permission, I will briefly provide a justification for each of these proposed additions to the SURGE membership. For the member of the general public, there have been numerous requests from members of the public to participate in the SURGE. Some are prior SURGE members whose terms have expired, but others are people interested in or who have personal experiences applicable to the work of the SURGE. Per a request from the Assembly, we added a preference for the public member to be fluent in more than one language. Emergency response professionals. The emergency response professionals are at the front lines of responses to the drug crisis currently occurring in the United States. Emergency response workers have seen an increase in the number of overdose calls over the recent years. Currently, law enforcement is represented on the SURGE, but there is no representation from this important first responder community who are partners in responding to overdose calls. Moving to the representative of the Division of Child and Family Services. A sizable number of children involved in the child welfare system are children who were removed from their home due to some type of substance use involvement. Approximately 74,000 children in the United States were removed from homes and entered foster care due to parental substance use in 2021. This represents 36% of child removals. Funding priorities for families and children affected by the opioid epidemic could be stronger with representation from people who serve children that have been affected by substance use. We'll also note in Section 1, subsection 2C, was amended in the Assembly per the request of the Division of Public and Behavioral Health to ensure the representative on surge. Moving to the Director of the Department of Indigent Defense Services, that department was created in 2019 and has been tasked with providing oversight and resources for our public defenders, especially in rural Nevada. According to the Office of Analytics with DHHS, from 2010 to 2020, emergency department encounters alone involving opioid use increased by 67%. During the same time, opioid-related overdose deaths increased by 5%. There's a higher probability that these same individuals at some time had contact with the criminal justice system. This is because people with substance use and mental health issues are disproportionately represented in the incarcerated populations across the United States and in Nevada. A large percentage of individuals navigating the criminal justice system have underlying life circumstances and non-legal issues that played a role in landing them in the criminal justice system in the first place, such as drug addiction, mental illness, or family or housing instability. The traditional public defender model that we see in the rural counties of Nevada is one that, due to a scarcity of adequate resources, focuses almost exclusively on criminal representation, to the neglect of the underlying issues that resulted in criminal charges. Public defenders in Nevada's rural counties have limited access to licensed social workers or other resources to address these underlying life circumstances. Because these underlying issues, which brought the individual into the criminal justice system, are not addressed, individuals are serving more time in custody at taxpayers' expense or may be rearrested in the future. The Surge believes that including a public defense perspective in this conversation will provide an opportunity for early intervention in opioid addiction. Representatives of the Nevada District Attorneys Association also made a request. Beginning in 2007 with the creation of Governor Jim Gibbons' working group on methamphetamine use, and continuing through 2017 with Attorney General Catherine Cortez Masto's substance abuse working group, at least one representative of the District Attorneys Association has meaningfully served on statewide committees designed to combat substance abuse. We believe that allowing the NDAA to resume its traditional role will complete Surge's interdisciplinary mosaic and foster comprehensive strategic programs to address substance abuse and misuse in Nevada. Thank you, Senator, for considering this proposal from the Substance Abuse Working Group and the Office of Attorney General. I am happy to answer any questions that the committee may have.
Thank you so much, AG Ford. Questions from committee members? Senator Titus.
Thank you, Mr. Chair, and great to see you, Attorney General Ford. Appreciate you being here, appreciate your passion for what you're doing. So certainly opioid is a major issue, and I recognize this surge is trying to have some impact. I'm looking at the surge report, and I'm just wondering, I can't really see how many meetings, this was just started initially in it was created in 2021? And how many meetings has actually been held by the surge committee?
Probably upwards of a dozen, but let me have Terry Kearns come up. We meet quarterly and have met quarterly since the inception, but we also have subcommittees, 3 subcommittees that meet in between our meetings. And so Terry Kearns is here. Dr. Kearns might be able to either correct me or augment what I've said.
This is Terry Kearns for the record. Senator Titus, I just wanted to address your question, and AG Ford is correct. The larger surge meets quarterly, and then there are 3 subcommittees: a prevention subcommittee, a treatment and recovery subcommittee, and a response subcommittee. Those committees meet more often. They meet about once a month or more often if needed, because the recommendations actually come from the committee level and then are pushed up to the larger surge.
Follow up if I might. And I'm curious as to, to pay for these meetings, any time, et cetera, are you using opioid settlement dollars, or is this non-reimbursable? These members don't get reimbursed for serving on this committee, at least travel or anything?
To my knowledge, this is a voluntary committee, Aaron Ford for the record.
Yeah, so there's no reimbursement.
Yeah,
right.
and then just as a point of privilege, I sit on the committee, and
That's
it's
right.
all voluntary.
Senator Donate's on the committee, Senator Stone's on the committee.
Right.
We've had, Senator Titus, I thought you may have been on the committee at one point, but maybe not. Okay.
I'm on a lot of committees, but I don't.
Not that one.
No, I appreciate that. And I'm looking at, your report is excellent, that was presented in January. I'm wondering how many actually bills came out of this report, because there was a lot of suggestions.
Aaron Ford for the record, that's a great question. And the answer is the one that I'm presenting to you. Surge is not provided bill draft requests. We don't have an allotment. And so it's incumbent upon the committee to try to find sponsors. I always allot one of my bills to the Surge Committee, as I do other committees on which I sit. Last session, the fentanyl bill that I passed that strengthened penalties for trafficking in fentanyl was the bill that I gave the Surge Committee. But aside from that, unless one of you legislators, looking at the recommendations that we've laid out over the course of the last 4 years, picks up one of those suggestions and runs the bill, it's only a suggestion that sits on the bookshelf.
And to be clear, I'm not advocating for you to get any bill draft requests, because
wish
I'm
you
a
would,
person
by
who
the
thinks
way.
there's too many bill drafts out there already. But just for clarification, I think some of these recommendations are really good. And I sit on the interim HHS committee, and did we address, and so we didn't bring any of these recommendations forward, did we, unfortunately? Okay. Well, anyway, I want to thank you for your time and effort, sir.
Thank you, Senator.
I'll comment that at the end. I just want to see if there's any other questions. Senator Stone.
Thank you, G, for being here, and it's been an honor to serve on the Surge Committee, and some very, very bright people that participate in that, and I can assure you it's completely voluntary, which is fine. To talk about the expansion of the committee, sometimes bigger is always better. Why do you feel that we need to expand the committee that I think is functioning pretty well? I'm not saying it wouldn't function in an expanded form, but explain to us why you think the expansion would be efficacious.
Thank you, Senator Stone. Aaron Ford for the record. This was a conversation that initiated at the request of individuals who wanted to participate on the committee. I chair the committee, and I brought the recommendation or the request to the committee for contemplation and consideration. In the committee as a whole, you may not have been quite appointed to the committee at that time, I don't believe, but had robust conversation around whether the additional folks could lend to the work of the committee, and they all thought so. And then beyond even the District Attorneys Association making their request, the committee itself came up with other suggestions that we have presented in this bill. So it's at the behest and at the request of the committee. The committee is a very active committee. It's a great committee. It always has great representation in terms of attendance. The subcommittees do yeoman's work on this thing, and so I don't think in this instance that more would deflect from the work of the committee. In fact, it will add to it, and I think that, again, accommodating the request of the committee as a whole to add these additional areas of expertise will help them in fulfilling their statutory duties.
And if I could just follow up, if you could just comment on the advocacy of the committee when it comes to distributing opiate settlement funds. I think that's an important role of the Surge Committee.
Aaron Ford for the record, actually we do not make decisions relative to the distribution of the opioid monies. I have made that patently and abundantly clear as many times as I could as the chair of that committee, because there was confusion to indicate, where folks believing that the Surge Committee in my office as a Attorney General had any say-so whatsoever in the distribution of opioid funds. That is not the case. Senator Julia Ratty in 2021, when she created the Advisory Committee for Resilient Nevada, ACORN, within the Department of HHS, created that committee so that ACORN and HHS could receive recommendations from Surge and other entities so that they could make determinations on how opioids monies would be spent to help eradicate and effectuate relief in the communities. And so the Surge Committee, while we make recommendations, we have no authority, no power, and beyond a recommendation, no influence in determining how those monies are spent. I just bring home the bacon. I'll put it in the hands of HHS.
Any other questions? The only comment that I want to thank you, AG, by the way, for presenting the bill. The only thing that I wanted to mention is I've sat on the search committee for 2 years. I think it's been a long time. I think even since last legislative session. It's probably one of the most comprehensive, robust groups that our state government has stood up, and I think the rationality of why I believe that is because you have been very passionate in leading us towards bringing different groups of different people together to produce recommendations, right? Whether they're folks that have been impacted by substance use or have had family members lost by it, all the way to policymakers and the healthcare professionals, right? All of us are represented equally on this group. And so I think what we've had in discussion so far, right, is sometimes we do miss law enforcement being a part of the conversation, or we miss EMS or other folks that maybe have more experience than others. And that's why I see the importance of bringing this bill to make modifications to whatever recommendations they make. And to that end, I do believe that if it is the preference of the committee, that we should consider giving them at least one bill draft so they can continue the narrative of the recommendations they're putting forward, and it gives them at least more teeth or more angling for when we come to the legislative session, on top of the opioid settlement funds that are being created, because not all the recommendations they're producing require money to be allocated to it, and some of this is just how we implement NRS. But I think that's more of a challenge. I don't know if you wanted to comment on anything.
Thank you, Senator Nate. Aaron Ford, for the record. I couldn't agree more. I do think it would be appropriate to give the search committee a bill draft request. That's obviously within y'all's purview, and you can determine how you want to do that. I mentioned the bill that I ran last time that strengthened penalties for trafficking in fentanyl. We also included a recommendation. I want to correct the record on this, Senator Titus. We also included one of the other recommendations from the search committee in that bill, which was to require medicated assisted treatment in our local jails and prisons. That was one of the recommendations that did not get a bill draft request solo, but it was one that I added to the bill at the request of several individuals and entities who were interested in seeing that take place. And I will also note, we've talked a lot about opioids today. And my office is very proud of having brought in $1.2 billion to address and affect the opioid crisis. But the Surge Committee isn't an opioid committee. It is a substance use response working group. We've talked about xylazine, we've talked about methamphetamine, we've talked about other forms of drugs and other substances that are used and misused and abused. And so I think it's important to note that as well. And so adding the expertise, I think, also adds to the ability to broaden our conversation beyond opioids. Opioids took a very big chunk of our time early on because my office was so intimately engaged in bringing in millions and millions of dollars to the state to affect the opioid crisis, that the Surge Committee spent a lot of time in trying to make recommendations on how that money should be spent and sending it to ACORN. But I do want to note Surge is more than just about opioids.
Senator Lang.
Hi, I'm wondering, in your committee, like what kinds of activities you do? Do you just have conversation and ideas about things, or do you go out and do community events? Do you come up with programs that the state should do? Just curious.
Thank you, Senator Lang. Thank you for the question. Aaron Ford, for the record. We have done a hodgepodge of things. We certainly do have a lot of conversation in order to produce that report that you have been given and the recommendations in there. So we get a lot of presentations from experts in the field all across the nation with updates on, we learned about xylazine through that committee because it was something that was percolating on the East Coast that had not quite made its appearance in Southern Nevada, but we expected it to come. And so we learned about that and had conversations around that. We have talked about, and I'll have Dr. Kearns chime in on this, having other community-like events. We've wanted to, for example, do a public service announcement, some PSAs, but they require money. And to Senator Titus's point, we don't have money, and it's all volunteer. And so we've had a difficult time being able to be more active in that arena to get the word out about substance use issues, opioids issues, and things of that sort. I mean, one of the conversations was around putting up billboards that said "one pill can kill," talking about opioids and fentanyl. But again, we don't have the money associated with the committee to effectuate that. We do try to have conversations in the community when we can have it. That's probably the crux of the conversation there. I don't know if Dr. Kearns wants to add anything to that.
Terry Kearns for the record. What I would add is that we work with other entities such as the prevention coalitions or the regional behavioral health policy boards and support events that they have, or will make recommendations that would enhance activities that they do or to try to enhance funding for them.
Thank you. Any other questions? Let's open up for testimony. Thank you so much. If you are here in support of this bill, we'll go ahead and invite you to please come forward for support testimony. I don't see anyone here in Las Vegas. AVH, is there anyone online?
If you'd like to testify in support, please press *9 on your phone to take your place in the queue. Chair, there are no callers in support at this time.
Thank you. If you'd like to testify in opposition, please come forward. I don't see anyone here in Las Vegas. AVH, is there anyone online?
Testify in opposition, please press *9 on your phone to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you so much. And last but not least, anyone looking to testify in neutral on this bill, please come forward. I don't see anyone here in Las Vegas. AVH, is there anyone online?
Testify in neutral, please press *9 on your phone to take your place in the queue. Chair, there are no callers in neutral.
Thank you so much. AG, did you have any closing remarks? He looks like he's waving it off, so we're going to go to close the hearing, and we thank you for coming for the presentation. Let's move on to our next bill. If you give me a second just to move things around. We are going to go to Assembly Bill 60. This bill revises provisions relating to certain behavioral health services, and we will invite Senator Titus and her co-presenters to begin.
Thank you, Chair. It gives me great pleasure to present to a committee that I'm on, so I thank you for that. As you know, I am Robin Titus. I represent in Senate District 17, which is 6 rural Nevada counties. So I represent all of Douglas, all of Lyon, all of Churchill, all of Mineral, all of Esmeralda, and part of Nye County all the way down to Tonopah. So rural health issues have been near and dear to my heart. This bill is being presented on behalf of the Northern Regional Behavioral Health Policy Board. Here at the table with me she'll be back, but I'll start with the one that is still here, is Director Ann Elizabeth Northern, Project Director of the Nevada Certification Board, and Sherilyn Raw Wood, the Northern Regional Behavioral Health Coordinator. She'll make her reappearance here shortly. Assembly Bill 60 was created by the board after months of meetings and deliberation and seeks to make changes to the language governing certified prevention specialists and peer recovery support specialists. I'm going to turn the presentation over to Director Northern now and Ms. Raw Wood for additional details, and they'll go through the bill itself and what it actually does and what a behavioral health specialist even is, and then we'll all sit back for any other additional information. Thank you.
All right, just give me 1 second. I'll pull that presentation up for you. Thank you, Dr. Titus.
You all have a copy of this in front of you.
All right. All right. Good afternoon, Chair Donate, Vice Chair Taylor. Good afternoon, Chair Senator Donate, Vice Chair Senator Taylor, and the distinguished members of the Senate HHS Committee. My name is Sherilyn Raw Wood, CHERYLYN RAHR-WOOD. And I serve as the Behavioral Health Coordinator, as Senator Titus stated, for the Northern Region. That said, I must state that I am a nonpartisan facilitator of the Northern Region Behavioral Health Policy Board. Here today in this role, I am only presenting the bill on behalf of the board and not advocating for its passage. Soon I'll hand the presentation over to Ann Elizabeth, who will be taking you through the history of this certified prevention profession, the why, the data, and all of that good stuff. But before we get started on the presentation, I just want to take a moment to really thank the Senate Committee on Health and Human Services for the opportunity, time, and space to present on Assembly Bill 60. On this slide, this is the list of our board meetings according to NRS 433, 4.429. And as you can see, the board has a spectrum of professionals from all over the Northern Region who work in the fields affected by behavioral health and public health issues. It has been and continues to be a privilege to be the coordinator for this board, as well as the region and the counties that I serve. This is a slide of our county seals, as well as the counties listed in alphabetical order. And these 5 counties make up the Northern Behavioral Health Region. And this is a map of Nevada, of course, as you can tell. But I just wanted to give you an idea of where the Northern Region is situated compared to the other 4 regions, as well as some general facts and data about the logistics and populations. The Northern Region might be small, but it is mighty. One thing I will say about the Northern Region is that working across county lines is part of their culture. I've been able and privileged to work on a couple of community projects, and they really enjoy working across county lines together in my region. So this is the Legal Counsel Bureau's long summary of AB 60. I know you guys all know what that says. This is AB 60, and this is really the section that we made the most changes in. And not only do these changes align with the Nevada Certification Board and International Certification and Reciprocity Consortium, the ICNRC as well as it's known, definitions, but they also define certification standards more definitively. It also aligns with Certified Prevention Special Competencies and SAMHSA's strategic prevention framework and guides the foundational development of the 3 Ps of prevention to fidelity. And then throughout the bill, the language changes of an adult to a natural person and adds the certified prevention title language where needed. Now I'm going to hand the mic over to Ann Elizabeth, and she's going to kind of introduce you to what a certified prevention specialist does.
Good afternoon. Ann Elizabeth Northen for the record. Thank you, Chair Dunyate, and members of this committee for listening to us today. For over 3 decades, Nevada has shown what's possible when we invest in prevention. It started with a single coalition in 1989, and today there are 10 coalitions, which you see up on the screen, serving every one of our 17 counties. These aren't just organizations, they're trusted community partners, deeply connected with the people that they serve. They listen to local voices, understand regional challenges, and build prevention strategies that are both effective and evidence-based. Through the Nevada Statewide Coalition Partnership, or NSCP, these efforts are united, allowing for shared resources, consistent messaging, and a coordinated approach to public health that reflects the unique character of our state. At the heart of it all is a certified prevention workforce, local experts who bring both scientific knowledge and community insight to the table. Thank you. Nevada's coalitions are more than prevention providers. They're mentors, educators, and champions for a strong public health workforce. They work hand in hand with public and private partners to maintain high standards, offer ongoing training, and ensure prevention professionals are well prepared to meet today's complex challenges. These specialists are certified through the International Certification and Reciprocity Consortium and the Nevada Certification Board and are deeply rooted in the communities they serve. Their rigorous training ensures robust capacity efforts and prevention programming that is effective. Whether they're leading youth engagement efforts, addressing substance misuse, or promoting safer, healthier neighborhoods, their impact is tangible. Go ahead and thank you. At the core of coalition work is the spirit of innovation fueled by collaboration. Nevada's coalitions don't just follow best practices, they help shape them. You can see on the screen and in the presentation in front of you many examples of the ways that we work together. From pioneering community health worker initiatives to promoting trauma-informed communities, they're creating real change on the ground. These programs reflect a deep understanding that effective prevention starts with people, listening to their stories, respecting community knowledge, and adapting to their needs. The strong emphasis on certification and evaluation ensures these programs aren't just visionary, they're also sustainable. Coalition work in Nevada is guided by the 3 Ps of prevention, as Sherilyn mentioned earlier: evidence-based programs, practices, and policies. This isn't just a framework, it's a promise to our communities that we'll stay accountable, informed, and effective. Coalitions play an active role in shaping the policies and regulations that govern prevention, bringing their lived experience and local knowledge to the policymaking process. This work is aligned with a broader national recognition of prevention specialists as a distinct occupation. This recognition is a step toward greater recognition and greater support for the essential work that our professionals do every day.
Thank you, Anne Elizabeth. For the record, Sherilyn Rohr-Wood. Understanding that there is a return on any investment is important, especially to a policy, program, or practice. How do you really know the value unless you can verify its benefits? Listed here are some return on investments that provide prevention is worth the investment up front, with 1,196 saved in annual social costs per patient from a hospital ED utilizing the screening, brief, interventions, and referral to treatment expert protocol. 31 billion saved in social costs from the Real Cost campaign, diverting 175,941 youth from becoming smokers. And so you can just see that that return on investment is really important. When we're looking at programs benefit cost ratio, or the BCR, it is an economic measure that shows the value of future savings or additional benefits achieved for each dollar spent. For example, as shown on the graph, every $1 invested in good behavior game program resulted in return of $62.80. So you can see that the benefit cost ratio of using evidence-based prevention programs implemented correctly can yield larger returns. I also wanted to point out that NRS that aligns with AB 60, which can act as a conduit to prevention and program implementation. When we look at NRS 388, school-based prevention with overburdened and short-staffed school district, how does the DOE, Department of Education, oversee the implementation of prevention programs? We focus on suicide prevention in NRS 388.256, but we don't widen the focus on the broader need for prevention of substance, alcohol use, misuse, violence, vaping, and harm reduction within our schools. But there, I can go on. It's just the coalitions that can implement these programs, but there needs to be review and oversights on the programs that are being implemented so we can stay consistent in our implementation and bring fidelity to the programs developed. When we look at NRS 488, was the development of the coalitions into statute, and now it's time to legally align the certified prevention specialist professions within those coalitions. Again, giving them that review power and oversight to supervise the 2,000 hours of prevention implementation new prevention specialists are required to do to become certified, as well as making certain that the programs that we are bringing into the state are evidence-based or best practice and implemented to fidelity. And then this slide speaks to the prevention specialist legislation around the nation that is either on the docket for this year's passage, such as in New York, or has already passed and been written into law, such as South Dakota and Oregon, just to name a few. With that, that's our presentation. There's our contact information, and then the reference slide.
Mr. Chair, if I might continue, Senator Titus, for the record. Again, the definition of what a certified prevention specialist is really in the section 1, what that means. Throughout my career in this building, frequently we've had to update as new professions are developed or new professions are identified. There's a need for education, documentation, some standardization of these professions. And so this bill was developed because these folks are doing great jobs, and we needed to update the Nevada language to be consistent with that. When I was a youth growing up, if you remember what prevention was all about, and I know that the chair, of course, would not remember these ads. However, there used to be a thing where they'd drop two eggs on a frying pan, and the eggs would be like just frying there, and the ad said, "This is your brain on drugs." And then there was another ad that said, "Just say no." And we all know that that just doesn't work. And so the prevention specialists have evolved into what real intervention is, and prevention is the key. And so with that, we will be happy to answer any questions. Thank you.
Thank you. Any questions? Senator Lang.
Thank you, and thank you for the presentation. So, this creates a new license, if I'm reading it correctly?
You're the license.
I can come off. Anna Elizabeth Northen for the record. There is already a certification in place for prevention specialists. This just legitimizes it in NRS.
And I looked online, and there's not a fiscal note attached to this, but if you're licensing people, it seems to me there would be a fiscal note. Not that this is the policy committee, but I'm just curious.
So there was a physical note at first put on it for some trainings that were for positions of prevention, but more direct service prevention and not more of what we're doing with communities and coalitions and such as that. So we were able to get that removed because we didn't need those people that the state was saying we need to have trained. And so we asked to have that removed, and it was removed. I think the physical note was like $3,400 or something like that. The cost to take the training is $149 through CASAT or Foundation for Recovery. But then it's that 2,000 hours of direct implementation that takes about 1 to 2 years to do those 2,000 hours. So we really didn't need that money. A lot of the organizations, the coalitions, fund that first initial amount of money, the $150 to get that certification, to help people get started in this field. And then usually they're hired by a coalition or something to work on those supervision hours.
So that was my question is, when someone goes to do those hours, they have to live, they have to pay rent and get groceries and gas and stuff, and so what I heard you say is that they're paid through coalitions or organizations, that there's no cost to the state, right?
That is correct.
Okay, thank you.
Vice Chair Taylor.
Thank you, Chair. And thank you, Senator and colleagues, for presenting this. I want to make sure I didn't miss it in this. So what the bill is, what the intention of the bill is really, it looks like there are two things really. One is to kind of set it up so that the licensure of the prevention specialist is codified in statute. Okay, that's one piece, right? And then the second piece I just saw in the secondary, has to do with, it sounds like some more technical kinds of things, align some, help me with that piece of it, so I can make sure I just understand what are we doing here with this.
Yeah, Anna Elizabeth Northen for the record. I think if we're talking about the intent, it's really to support evidence-based practices, programs, and policies, right? And so to be able to have sort of this foundation of legislation from which to work from and ensure that our professionals are qualified and are receiving support. Coalitions are one way that occurs. There's a system there to help support professionals, and yes, that's why that fiscal note is not there, is because we have a strong infrastructure for this programming and these professionals that are working. Did I answer your question with that?
Yes. Yeah, I guess I just want to. So you're looking for the alignment of the practices, right? The principles, the policy. That's the second piece of it. Now that we can get them licensed, right, in state statute, now you want them to make sure that this is something that's solid, that's evidence-based, and so on. And that's the second piece of this.
Yes, absolutely. Anna Elizabeth Northen again for the record. Really, that piece of that oversight piece and ensuring that prevention is done well is so vital to the work that we're doing Senator Titus mentioned a little bit earlier, some early prevention efforts that aren't effective, the Just Say No campaign, and things of that nature. And prevention science has really evolved to ensure that we're addressing risk and protective factors and getting to the root causes of what's going on with our substance misuse. And so one of the facets of this is to ensure that prevention is being done properly in our communities and really helping our communities to thrive. Thank you.
Thank you so much. Thank you, Chair.
And Chair, if I might add, Senator Titus, I think it also gives some accountability to the positions. In other words, they will be, part of what this says in Section 9 of the bill itself is that they are accountable to the division, DPHS, and that they have to be held responsible, giving them a formal position and a title. And so for me, they have to be able to do their job, and they also have to be able to hold them accountable, and that they're trained and know what they're doing.
Thank you, Senator. Thanks, Chair.
Any other questions? More implementation from my side. The 18 years of age requirement, I know that some states differentiate this. Some do, some don't. What was the rationality of following states that have an age requirement? And the reasoning why I'm asking you this is because I could see down the line that we can develop a CTE program that provides students to go into this pathway, and so some may complete the program below the age of 18, and so I'm just asking more on the semantics of why that level was made.
Senator Titus, for the record, I'll answer that because we actually addressed that. Our original bill had that you could be 16 years of age. We were very worried about the liability language, and then so we took that back out because of our members were concerned about the accountability, because that's one thing this bill holds the professionals accountable. And we were worried about the liability for youth, children under, adult, semi-adults under the age of 18. They certainly could be peer specialists, but when it comes to be a specialty, there's some accountability to your actions. And so there was a lot of debate on our committee on whether or not we should include youth, and that was the original language. We felt that this first step was probably best until we could work that out, and maybe in the future you'll see something including the youth, but we didn't really. Some of our members were, all of our members were very concerned about the liability for the youth if we included them in this bill. And we had originally.
Thank you. And just following up to that, another reason why, so now just doing the contradictory, right, of state or folks that have advocate, and I don't know if there's any opposition to this, I'm just spitballing here, but in some states, they have usually traditionally have not gone the certification route because it can be an impediment because of geographic boundaries and just the transition of folks who are not certified to becoming certified. So is there any consideration as to when the bill comes into play, if there are folks that are already doing this type of work, what would be the transition to getting them certified, and if there's a grace period or so forth? I guess we're kind of catching up to people already doing the work. So I just want to make sure that was clear.
And Elizabeth Northen again for the record. The certification has been in place with the Nevada Certification Board for some time. And so the majority of professionals who are working in this space are moving towards that certification, are in process for that, or already have it. I myself am a certified prevention specialist. And so that piece has already been built. Again, this is really codifying what is happening in our communities.
Sorry, let me just make sure that question was more specifically targeted. I'm assuming that there are people who are doing this scope of work that are not certified. Is that correct?
Certainly. I would assume, my assumption is that most of those folks are in the process because we have this robust coalition infrastructure in our communities serving all 17 counties. Those coalitions are often in touch with direct service providers who are providing this scope and working with them to become certified. I'll give you an example from Washoe County. I was also the executive director for Join Together Northern Nevada, a coalition. And so we worked with subgrantees like Big Brothers Big Sisters and Boys and Girls Club to move them towards certification as well. So while all certifications don't need to be housed in coalitions, coalitions really come alongside and support those professionals in the field.
Great, thank you. I think the reasoning why I was asking that is by putting a state law of a certification, does that put folks out of employment or in jeopardy of their current employment? And so that's why I was looking at the transition. The reason why I was asking these questions is I'm equating it to when we established community health workers, and I think there were some challenges of what we wanted to perceive versus what was actually implemented. Most of it came to the challenges of how tribal health is ran, and that's why I didn't want to replicate the same problems of what we did with a similar position, it's sort of say. So that was more the rationale for my question. So, but it sounds like if there's any tweaks, we could just do that offline if there's anything to be made. So.
Absolutely. And Ann Elizabeth, for the record, just to kind of say one more thing on that and to drive towards your questions, certified prevention specialists are pretty rigorous, right, through the International Reciprocity Consortium. And so they're required to complete 2,000 hours in the field. And so there's quite a bit of work that's done with professionals. And so if people are in the midst of that scope of work, there is time to develop them and to train them and to work with them. I wouldn't perceive that to be an issue that would arise in this scenario. Thank you.
Great. Thank you so much. And to the comment, I do not remember that commercial, but I grew up under a different commercial. The commercial that I remember as a teenager was the girl that was deflated on the couch. I don't. There was.
Wasn't that on MTV?
I think it was on MTV, but I can't recall. I don't know. I'll share the link with it. But yeah. All right. Let's go to let's go to testimony. All right. If there are folks that would like to testify in support of this bill, if you can please come forward. And we'll begin here in Carson City. Please begin.
Thank you, Chair and Committee. My name is Sabrina Schnur, SABRINA-SCHNUR, and I'm here on behalf of the National Alliance on Mental Illness Nevada Chapter, NAMI Nevada, and we are in full support of this bill. Thank you.
Thank you, Chair. Blaine Osborne, Nevada Rural Hospital Partners, for the record. Happy to be here in support. Thank you.
Thank you. Anyone else in Carson City? Let's go to Las Vegas. I don't see any AVH. Is there anyone online?
If you'd like to testify in support on AB 60, please press star 9 on your phone to take your place in the queue.
Hi, this is Katie Zeller. I'm in Fallon, Nevada, and I'm a certified prevention specialist in the north, and I'm also a member of the Nevada Certification Board's Prevention Specialist Committee. I think it's been said that certified prevention specialists are integral to all of our communities. I know there was mention of our tribal communities, and it's especially integral for us because we are able to, as a tribal member, I'm able to provide oversight and insight through evidence-based strategies along with participatory-based research strategies to ensure that what we're doing and our methodologies are appropriate for the communities that we're serving. And it's essential to have informed individuals to help advise our communities to ensure that each of us is accurately represented. Thank you to the state for supporting this initiative.
Chair, there are no more callers in support at this time.
Thank you so much. Let's move to opposition. Is there anyone in opposition? I don't see anyone here in Las Vegas. AVH, is there anyone online?
Testify in opposition on AB 60, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in opposition.
Thank you so much. And let's move on to neutral. Anyone testifying neutral? Looks like we have someone in Vegas. Please begin.
Thank you, Chair and members of the committee. My name is Jamie Ross, R-O-S-S, and I am the director of the Nevada Statewide Coalition Partnership. I am here as one of the first cohorts of certified prevention specialists in 2017, and I believe good prevention work saves lives. What we know is many who are interested in doing good work, but do not have an understanding of the science of prevention, best practices, and as we like to say in our field, bad prevention can be worse than no prevention. This certification ensures we do work and utilize funds in a way that does not have any unintended negative consequences. I work at a prevention coalition, and our coalitions across the state house many, if not most, of the prevention specialists in Nevada. There is interest in expansion of this field, and this will be supported by this field being recognized by the state of Nevada. Thank you.
Thank you. Anyone else in Las Vegas? AVH, is there anyone online?
To testify in neutral, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you so much. And for the record's clarification, I've been alerted that it was a above the influence advertisement, and it was an anti-cannabis ad from the early 2000s. So if you want to watch it, it's pretty funny. So, does our presenter have any closing remarks?
Thank you, Mr. Chair and members of this committee, Senator Titus, for the record. I think the take home from, even though we did it in jest, and the reality is this is a multi-generational issue that has spanned all of our lives, and prevention is really the key in my mind. We treat too many people, and it's much better and much, I'm a fiscal conservative, and I will say I believe in Ben Franklin's statement, an ounce of prevention is worth a pound of cure. And so I think these professionals are critical to the process. I did get some clarifications from my own knowledge regarding the certification. There's no charge for the certification. There is, when they take their test, they have to pay for the test, but that's a different board. But the certification is not a charge to do that. So there's not like that licensing fee that we experience in my world, and teachers, et cetera. So hopefully you will support this bill, and thank you for hearing it.
Thank you much. Thank you so much, Senator Titus. I'm going to go ahead and close the bill hearing, and that brings us to our last agenda item of the day, which is public comment. Is there anyone that would like to provide public comment at this time? I don't see anyone here in Las Vegas. AVH, is there anyone online?
To participate in public comment, please press star 9 on your phone to take your place in the queue. Chair, the public line is open and working. However, there are no callers at this time.
Thank you so much. That concludes the work of today's meeting. We have been referred a lot of bills, so we're going to continue to work up until next Tuesday, and we will see folks, Thursday. Today's Tuesday. Yes. We will see folks this Thursday with plenty more bills to hear, and the meeting's now adjourned. Thank you so much.